Hello everyone. Today's video is about optimal testing for vitamin B12, about optimal testing for mold, and about why someone might be reactive to glutathione or sulfur. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you wouldn't mind taking a quick moment at some point to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate that. So thanks in advance for taking a second to do that. So the first question here is, it says, I just heard that B12 blood serum is not an accurate representation or if you're actually absorbing vitamin B12. Is it homocysteine levels that we are supposed to test to see if we're able to utilize the B12 that's floating around in the blood? Also, I heard it's good to take a lab test of MMA, which is methylmalonic acid, or MCV, which is mean corpuscular volume. So thanks for the questions. So my understanding is that when we take a blood level of vitamin B12, a serum level, that's telling us how much is floating around in your blood, full stop. Now, many things that float around in the blood seem to be good representations of our tissue levels of those things, or they give us like a good sense of what's happening physiologically related to that. You know, you measure say ALT, for example, as a liver function enzyme, and it gives us a pretty good sense of whether or not the liver is inflamed with, hepatitis, having hepatitis for some reason, or there's liver damage for some reason, which would also manifest as inflammation, hence hepatitis. So blood tests are very, very useful. However, with vitamin B12, the amount floating in the bloodstream does not seem to correlate, in my experience at least, and I believe there are many other clinicians out there who would agree with me, that B12 levels in the blood does not predict whether or not someone is going to feel better from taking a B12 supplement or getting B12 shots. And I say that with a high level of conviction because I've had many patients over the course of time who have felt markedly better with B12, and their B12 levels are totally fine. Many of those patients, as they're supplementing with the B12 for a while, their blood levels become quite elevated, and they continue to feel better taking that amount. They don't take it and start to feel worse. Not to say that they become addicted to taking it, but that until we correct the underlying reason why they're having the need for that extra B12, until that's corrected, they seem to need to take sometimes very high doses of B12. So I would absolutely say that blood levels of B12 do not predict whether or not we need more vitamin B12 or not. Now, that being said, if somebody is low in vitamin B12, then that's a good predictor that that person probably needs more vitamin B12. So that's kind of the first part of my answer there. The other question, or part of the question here is homocysteine the test that we need to run to see, where our B12 levels are sitting. So homocysteine is a good marker to my understanding, a good marker for whether or not we're methylating well, and we certainly need good levels of methylcobalamin, or methyl B12, in order to break down or metabolize, I should say, homocysteine, turning it back into methionine. So if homocysteine levels are elevated, that can be a surrogate marker that maybe we don't have enough vitamin B12, but it could also mean that there's something else going on with methylation. So it's not specific to B12, but if homocysteine is elevated, then it might mean that it definitely means that, or almost always means that we need to methylate more. There could be some other reasons. There might be a blockage with the transsulfuration pathway, which is another way that we get rid of or metabolize homocysteine. So it can sometimes mean that. That being said, many of the patients that I've treated who have elevated homocysteine, excuse me, they have cardiovascular issues. Like homocysteine, when it's elevated, can be a marker of or can be an indicator of increased cardiovascular disease risk. And a lot of the patients that I see who have elevated homocysteine, they go on B12, and it can be very effective at lowering their homocysteine levels, but oftentimes they don't feel better from it. They oftentimes don't say, oh yeah, I have so much more energy after I got my homocysteine level down taking that B12. So I would say that homocysteine can be an indicator of maybe definitely somebody needing more methylation support, but not whether B12 is going to make them feel better. So if I had patients who, like, say, if I had a room full of, in my experience, if I had a room full of 100 patients, all of them had chronic fatigue for various reasons. Good chance that the vast majority of their B12 levels in their blood would look fine. Some of them might have elevated homocysteine levels, but probably, again, based on my experience, probably like 25 to 30 of those 100 would probably feel at least somewhat better on high-dose vitamin B12, and usually we do that in the form of B12 shots, sometimes getting those shots multiple times a week that they learn how to self-administer them at home, and it's very user-friendly, quite inexpensive. It's a wonderful, wonderful therapy. I've posted videos about this before. So in those patients, I would be very surprised if we saw a strong correlation between that 25 and that 25 to 30 all having elevated homocysteine, telling us with good evidence, good authority that yes, they definitely need more vitamin B12. So I think homocysteine is a useful test, but it's not the be-all end-all when it comes to predicting who's going to need more B12 and who's not, at least on more of like a feeling better from B12 level. Let's see here. Was there another part of that? Oh, right. And then talking about MMA, so methylmalonic acid and mean corpuscular volume. So going with the MCV first, that mean corpuscular volume, so that's the average size of a red blood cell. So when the average size of the red blood cell is elevated, that can be an indication that there is a B12 deficiency. It can also mean that there's a folate deficiency. It can also mean that there's a vitamin B6 deficiency, or maybe all of the above. And so it can be a useful indicator, but similar to what I said about the homocysteine, many of my patients who benefit a lot from, or also what I said about serum B12 levels, many of the patients that I have who benefit from B12 shots, they do not have elevated MCVs. So I don't think it's very good at predicting who's going to feel better from B12. Now, if someone has like full-blown pernicious anemia, they definitely need B12. They're feeling really tired. Like, yes, absolutely, MCV is very useful, but in the context of someone who does not have pernicious anemia, I have not found elevated MCV to be a very sensitive predictor of folks who might need more B12 in general. With methylmalonic acid, so that's an interesting one. So methylmalonic acid is this organic acid that's produced in the body, and we need vitamin B12 in order to break it down. We need to be able to, that's a requirement for it. And so the idea is that if we measure the methylmalonic acid level in the blood or in the urine, and if it's elevated, then that means that there must not be enough vitamin B12 inside of the cell. So they talk about the MMA being a sort of good test for like an intracellular level of B12. The MMA is a methylmalonic acid level is part of the organic acid profile that's done, like the organic acid testing that's available through labs like Mosaic Diagnostics, formerly known as Great Plains Laboratory, probably the best known lab for organic acid testing. I think US Biotech is another lab that's doing that now, or they've been doing that for a while. So MMA is part of that profile, and if memory serves, I think it's part of the Dutch test as well. 99% sure about that. I really honestly don't really pay much attention to it because it's almost always normal, and broken record here, but it seems to be another test that is not that good at predicting who's going to actually need vitamin B12. Then I have had a few patients where their MMA was elevated, and then I put them on B12 and they didn't feel any better. So I don't know if folks listening, especially any clinicians listening, if you have any input to chime in there, or just like, yes, MMA was really useful for figuring out my B12 needs. I'd be curious to hear about that, but yeah, really underwhelmed by the measuring methylmalonic acid levels. So I just haven't really seen a whole lot of benefit to it. I did not think I would spend that much time talking about vitamin B12, but here I have spent a lot of time talking about vitamin B12. So I'm going to do another video about the mold testing in a moment. I'll just quickly speak to the last question here where it says, what do we do if we cannot tolerate glutathione or sulfur? It makes me so sick. Searing brain lining pain and more fatigue. So this was a question that was posted on a video, my video interview with Dr. Kathleen Janelle, where we talked about high-dose MSM. So it's challenging. If you can't tolerate glutathione and sulfur, it's oftentimes an indication that there are a lot of toxins built up in the body, maybe a lot of microbes built up in the body, mold mycotoxins, and so we need to just go like really, really slowly. We can't be fully allergic to sulfur because sulfur makes up a large portion of our human bodies. So it's really more of like a functional issue in all likelihood, where the glutathione is just pushing toxins too quickly, or maybe the sulfur is pushing things too quickly, or maybe leading to a die-off reaction because sulfur does have some antimicrobial properties to it. So in those cases, we'll either just start really, really low and build up slow, or we'll work on supporting the detox pathways in general. Maybe work with some other like weaker antimicrobials first, and then gradually build up. But those are tough cases to deal with, but it is circumventable in my experience. I hope this was of interest. Any other questions, just post in the comment section below.